Starting so here. Good morning. My name is Naz. My name is Naz. Today we are talking about diabetes, its impact on eye health, and we have a very grateful Dr. Tandava Krishnan from Dr. Agarwal Sai Hospital, Hyderabad. So we all know that diabetes is one of the most common disease, but sometimes we don't know that it's also effect on our eyes because eyes are very important organ in our body. So sir, please tell us what the bad effects of diabetes.
So diabetes can affect the eyes in two or three ways.
Okay.
The most common is, or more prominently, is that a poor control of diabetes causes an early formation of cataract. But more importantly, it also causes a very sight-threatening condition called as diabetic retinopathy. So diabetic retinopathy, cataract, most of us know, is the clouding of the lens of the eyes. But diabetic retinopathy is the changes of diabetes in the retina, which is screen of the eye. And this happens because of a series of changes that happen or get affected in the retinal blood vessels.
So sir, is it cause for a blindness or a vision change?
Yes, for example, if it is just cataract, it is something which can be corrected by a cataract surgery. But diabetic retinopathy, if not treated on a timely manner, or if not detected and managed in a timely manner, can cause severe impairment of the vision.
So sir, is it also depend on a lifestyle?
Yes, in the sense, like, see, because it is obvious that diabetic retinopathy is because of poorly controlled diabetes. So, any person who has poorly controlled diabetes can have the manifestations of diabetic retinopathy, and this happens because of not only poor control of diabetes but also associated factors like hypertension, poor control of cholesterol, and renal, that is kidney problems.
Yes, yes.
So in addition to that, so these are obviously associated with what kind of physical activity you undertake, the kind of food you take, as well as there are other lifestyle choices that we make. For example, smoking is a very big factor in the progression of diabetic retinopathy. So yes, the kind of food we eat, the kind of physical activity we do, and lifestyle choices like smoking do affect the causage as well as the progression of diabetic retinopathy.
Okay. Thank you. Sir, so what are the symptoms of diabetic eye health?
So, like I said, see, for example, if it is cataract is a slowly progressive condition. So, the patients may initially not realize that there is some problem, but over a period of time, they would realize that their vision is going down. More importantly, when we talk about diabetic retinopathy in the early stages, especially when there is no involvement of the central part of the retina, the patients may not be having any symptoms. But if the central part of the vision gets affected, then the patient may have decreased vision or sometimes difficulty in seeing bright light, or he may also see black spots in the visual field, or there may be distortion of vision. There is distortion can be simply said, it is like when you're looking at two straight lines, the lines may not look straight, they may look contorted, or they may be it's like, the lines, though they are parallel, they may appear like they are stretched apart or joining together. These are some of the symptoms, but these, for us to visualize or notice these symptoms, one is they may not be present in the early stages, and second is because if the manifestations of the condition is not same in both the eyes, the good vision in one eye may mask the poor vision of the other eye. So we have to be very careful. It's not that in case you do not have any symptoms, you really do not have any diabetic retinopathy.
Okay, thank you. So, sir, can diabetic eye disease be prevented?
Yes, diabetic eye disease can be prevented. Like I've said, the various risk factors are diabetes, poorly controlled cholesterol, poorly controlled hypertension, uh, poorly controlled renal parameters such as blood urea, serum creatinine, and uh, also poor hemoglobin, that is anemia. Along with that, the lifestyle choice of smoking. So we have to. There is a very simple mnemonic for this. That is track. Track is T stands for take your medicines correctly. R is reach a good body weight and maintain it properly. A is maintain your ABCs, which is A for hemoglobin, glycosylated hemoglobin, which is HbA1c. B is for blood pressure, and C is for cholesterol. And PRAC. Um, and last, okay, A is add more physical activity. C is maintain your ABCs, which is what I've said already, and K is kick your smoking habit. These are the things which prevent, the negative impact of diabetes on the eye, inside the eyes.
Okay, so sir, what's the correct time to go for a checkup? Who
So
are
the,
diabetic
the
patients?
correct time to, like I've said, there is no easy way to identify the symptoms of diabetic retinopathy.
Yeah,
So
definitely.
the best time to go for a diabetic checkup is as soon as you know that you have diabetes, and subsequent follow-ups will be decided by your doctor based on the severity of the condition and whether any treatment is needed or not.
So which kind of treatment given in the diabetic patient for her eyes?
So it depends on, like, if the patient has cataract, it's a cataract surgery. If the patient has got a diabetic macular edema, then based on the severity of macular edema and the location, we can consider going for a laser or injection, or in certain rare conditions, maybe even a surgery. And in case the patient has got proliferative diabetic retinopathy, which is abnormal blood vessel formation, in such situation, the patients may need uh, laser or surgery, and in certain rare cases maybe injections. Again, the decision making is best left to the surgeon, but the key point is for us to reach the doctor at the right time.
Okay, thank you. Can diet and nutrition help with the diabetic eye health?
Definitely, because like I've said, the various risk factors are poor control of diabetes, poor control of hypertension, and lipid profile, as well as the renal parameters. A good control of these things definitely will depend on the kind of diet and nutrition that we take, and restricting ourselves to all the medical suggestions and the nutritionist advice, how to keep these things under control, that helps. So yes, diet and nutrition have a good role to play in this.
So is there any other advice you want to give us?
The only advice is that if you're diabetic, go and get yourself tested, even if you do not have any symptoms, because it is very difficult to identify the problem without having a good proper examination. And secondly, uh, what we need to understand is, like, unlike a cataract surgery, which is a one-time event, this is a lifelong event, and lifelong we need to follow good control of systemic parameters and have a good regular checkups with your doctors, even once the treatment is done.
So thank you so much, sir, for awareness about the diabetic or a diabetic patient. So thank you
Thank you
for
very
coming
much.
here.
Yeah.